First is Dr. Doug Dokery. He's a professor of environmental epidemiology and chairman of the Department of Environmental Health at Harvard School of Public Health. And Professor Dokery is most well known, and he will speak about his experiences that date into the 1990s. Is that about right? Where he played a very leading role in promulgating and quantifying the impact of particulate air pollution on human health, and experienced, very parallel to what we're experiencing here today, pushback from the fossil fuel interests to suppress the science that he found was the case and is robust and was robust. And we, again, appreciate very much your coming, and Dr. Dokery.
Thank you, Jim. Thanks for the invitation to be here, and the beautiful weather up here. It's a gorgeous day out. Hope we can spend some time outside. So, Anthony, can you help me out? Actually, what I wanted to talk to you about was not some of my bad experiences, and I wanted to start actually with a more positive note. I think we've had remarkable improvements in air quality in the United States, and in fact, we've seen tremendous benefits from control of clean air. And in fact, the U.S. government, the Office of Management and Budget, every year, in fact, does an analysis of the cost and benefits of all regulations. So this includes the Consumer Product Safety Commission, the Food and Drug Administration, the Transportation Safety Administration, the FAA, everyone, all the government regulations that exist controlling our air, food, water, safety, whatever, and evaluates what the cost of those regulations are and what the benefits are. And consistently, every year, what turns out is the largest benefit of any regulation, any law that the U.S. government implements are due to control of a single air pollutant, and that's fine particulate air pollution. And in fact, the estimated benefits of this are on the order of $18 to $167 billion in benefits at a cost of about $7 billion. So you can see the difference here in the benefits versus the cost are on the order of 20 to 30-fold. And so this has been a huge savings in terms of life expectancy and reduced health care and so forth. And these translate into real dollars that are being saved because of the costs that are being, the control of air pollution through the Clean Air Act. And you might be able to see here, actually, I don't know if you can make this out, but most of these benefits actually come from mortality. From the next slide, you can see where these, in 2010, it was estimated the costs were $27,000, where the benefits in terms of reduced mortality, chronic bronchitis morbidity, so on. Actually, asthma comes into the other morbidities. This is not to diminish the very serious effects of asthma in the population, but when you start counting up the cost of this, the overwhelming cost of this, and what gets the attention of the lawmakers, gets the attention of the regulators, are the mortality effects, which you can see are huge here. So where does this evidence come from for mortality effects? As Jim said in the next slide, part of this came from a study that we started in the mid-1970s of mortality in 6 cities across the United States, looking at a sample of adults in 6 communities. We selected 2 dirty communities, Steubenville, Ohio, and St. Louis here, 2 clean communities, Portage, Wisconsin, and Topeka, Kansas, and 2 intermediate communities, actually here, Watertown, Massachusetts, outside of Boston, and Kingston, Harriman, Tennessee. We enrolled people into these studies, asked them about their history of smoking, occupation, and so forth, and then followed them. Basically, we sent them a postcard every year and asked them, are you alive or dead? Check one box. And they would write back to us and tell them. We would get the information, and if they were dead, then we got their death certificates, found out the cause of death, and followed up that way. So this leads to the next slide, the next picture. This is the basic analysis, and this is what we call a survival curve. So we started here at time 0 and followed these people over time, and over up to, in this case, 16 years. And we start with 100% of the population, and as time goes on, people die, and you can see that by the time we get out here to a dozen years or so, we've got 90% of the population here and 80% here are still alive. So in these cities, you can see people are dying faster than in these cities. And if you look at this, what are these cities? These are Portage and Topeka. These were our clean cities, and this is Steubenville and St. Louis. These were our dirty cities. So it became very clear that people in the dirty cities are dying faster than people in the clean cities. And in fact, the people in the in-between cities were dying at an in-between rate. So it's not, well, I hope this isn't news to you, but it's really not whether you die. We're all going to die. But it's how long you live. And if you look at, how long people are living here, people are living longer in the clean cities than in the dirty cities. So the real question is, does air pollution make you die earlier? And when we look at this analysis in the next slide and adjust for, lots of individual characteristics, these are 6 cities. And we can see plotted against the air pollution levels, the particulate air pollution levels, and we can see that life expectancy goes down in these cities as particle pollution goes up. And this is actually pretty substantial. We're talking about several years, 3-4 years difference in life expectancy that apparently is related to air pollution. Now, for some of you young people, when we talk about 2 or 3 years difference in life expectancy, that might not mean much, but when you get to be my age, it's, you're talking about something that really is very important. And just to put this in context, if we cured all cancer in the United States, just totally got rid of cancer, the net effect on life expectancy would be 2 years, increased life expectancy. So we're talking about air pollution effects that are comparable to the total burden in the U.S. population associated with cancer. It makes you realize what a big public health issue this is. So as a result of this, the EPA set a national ambient air quality standard, actually here at 15 micrograms per cubic meter, somehow taking these data and figuring out that's where it was safe, although it looks like there's still benefits below that. But in 1997, we established a new ambient air quality standard based in part on these data to control air pollution and setting a limit of 15 micrograms per cubic meter. So as a result of these controls, in fact, we've seen major improvements. The next slide is a little cut off here at the bottom, but what's across the bottom here are years. It's okay, we'll survive this. These are years going, I think, from 1980 out to 2000. And the main point is you can see all the different air pollutants, and you can see that what's happening is that concentrations have been going down. As a result of the Clean Air Act being put in place in 1970, we can now pick this up, 1980. We've seen air quality improve all across the nation. And here's when we put the standards in for PM 2.5, and those have been going down, ozone, CO. Some have been very dramatic, such as the removal of lead from gasoline. Others have been, and control of carbon monoxide. We're still struggling with ozone, and you can see the fine particles, the PM 2.5, we're starting to get under control. The question we asked is, can we see the benefits of this in terms of the health of the population? The next slide, raises that question. Next slide. In fact, if you look across the country and look at life expectancy, these are life expectancies in counties, in this case for white males and females, for every county in the U.S., and you can see this is ranging from 65 years to 80 years. So you can see the disparities across the country in life expectancy. And some places in the South here tend to have low life expectancy compared to the Midwest, for example. You can see looks like it's reasonably good here in New Hampshire and New England, northern New England. But the question is, can we look at changes in life expectancy per year, and can we see that difference in life expectancy related to air pollution? And the next slide, we found 50 metropolitan areas across the United States where we had historical air pollution data going back to 1980, when slides saw the downturn. And we compared mortality, life expectancy in these communities with air pollution in 1980 and again 2000. And the next slide. So this is going back to basically around the 1980s. These are the 50 metropolitan areas in that map. The mean air pollution fine particle concentrations we had at that time versus life expectancy in those communities. And you can see there's a lot of scatter, there's a lot of difference in air pollution. There's a fair range in life expectancy. But in general, and what you see here in 1980 as air pollution goes up, life expectancy goes down. And actually it's very similar to what we saw in the 6-city study. And in fact, 3 of these cities were in the 6-city study. If you hit the button once, we see this overall slope. And the next, so here's Boston. And the next slide, here's Steubenville, which was one of our cities. And the next one is Topeka. And so you see, in fact, just looking at the national statistics, we can see basically the same thing we saw with our study, that we see decreasing life expectancy across these communities. Here are 3 of our communities. You can also see actually why we picked these communities. Topeka is one of the cleanest places in the country. Steubenville is one of the dirtiest, and then Boston was right in the middle. So in fact, in this cross-section confirms what we saw in our big, expensive follow-up study, just a snapshot in 1980. Let's go ahead 20 years, and then here are the ambient air quality standards. So you can see actually at this time, most of these communities actually were above the standard, in violation of the standard. Now let's go on to 20 years later now. We're up to around 2000. What's happened? These are the same scales as we had in the previous. So I haven't changed the scales, but what's happened? Life expectancy has gone up. Everybody's shifted up. Air pollution has gone down. Everybody's shifted to the left. And now most of these communities actually are below the standard, although we still have a few above the standard. But even under these conditions, you still see the suggestion that mortality or life expectancy is going down with increasing air pollution in these communities. And in the next slide, these were Boston, Topeka, and Steubenville. So in fact, these communities themselves have improved. The next slide, I looked up trying to find a representative site here. The closest one I could find was Pembroke, which has a mean of 8.9. So it's here on the lower end of the scale. So clearly, I mean, if you look at it, it's a beautiful clear day. It's characteristic of the pretty good air quality that we have here. But again, you can still, there is a suggestion that even at the levels essentially below the standard, there seems to be this continuing correlation that as you decrease air pollution, that the life expectancy continues to go up. And if we put these 2 time periods together, so this is now the 1980 data, this is the 2000 data for those cities, and you can see it really suggests a continuum here that it's very consistent. And if you look at the individual cities, I think Steubenville here to here, Boston went from here up to here, so in individual cities, air quality has gotten better. We can see improvements in life in these communities. And probably what is most interesting here is Topeka, which effectively did not change at all, and you can see there was just a tiny, tiny little improvement in air quality. So it looks like the places where air quality got the best, improved the most, we saw the biggest improvements in life expectancy, and where we had effectively no change in air quality, there was almost no change in life expectancy. So the message is that, you know, we've done a lot. We've shown the effects of air pollution in the population. We can estimate what the effects and benefits of that are, and the OMB, Office of Management and Budget, has done this. It's all a big statistical exercise, but, you know, we have real data in people showing that we've seen benefits now across the United States, that as air quality has gotten better, we've seen life expectancy is improving in a fashion that's consistent with what our expectations are. So this is confirming, you know, the statistical exercise on the cost-benefit analysis. And I think I had a couple conclusions here. The next slide is that improved air quality, in fact, does lead to measurably improved public health. And in fact, it appears from these exercises that what we've done in the past year added up a steady life expectancy to the population, which is significant. And these benefits are almost, even now, considered almost every in the country, subsets as air quality keeps improved below the current standard. So we shouldn't take it as being a definitive number here. We should continue to work for clean air, even in communities. So thanks very much.